Hey, hello, my name is Harshraj, Dr. Harsh, and we are going to learn clinical bacteriology. And let's begin clinical bacteriology. The first of all, we know that bacteria are divided into gram positive and gram negative based on some characteristics. As we know that catalyst and other tests we will further know. First of all, we will go with gram positive algorithm. So we will divide all the bacteria of gram positive based on shape morphology, based on some taste positive or negative, or based on oxygen dependency, aerobic or anaerobic, or some other criteria. Okay, let's begin with gram positive bacteria. So for gram positive bacteria, we will write in blue color gram positive. Okay, this is algorithm. May I correct algorithm? Okay, I don't know perfect spelling or not. Let's begin. So based on shape morphology, we will divide gram positive bacteria into three types, that is bacilli, cocci, and branching filaments. Okay, branching filament means it branches out. Okay, so based on that shape morphology, we will divide into three types. Okay, it's fine. Okay, so here we will write branching filaments. Here we write cocci, and here we write bacilli. So bacilli shape is like this, cocci shape is like this, and branching filament shape is like this. It branches, it branches, it branches. Like, see this shape, see this shape, and this is shape. Okay, it's clear. Okay, now further we will divide this shape morphology into oxygen dependency. So some bacteria which depend on oxygen are called aerobic, while some which are not, we will call them anaerobic. So we will further divide bacilli into anaerobic, anaerobic, like that. For bacilli we will do same for branching filaments bacteria, aerobic, anaerobic. I I will not tell you that this the algorithm of this gram positive algorithm is derived from the first aid book. You can check out this book in my description. I have not been paid or something else. Just I am giving reference. If you want to have a clear image of that with algorithm, you can just check out in first aid book. I am going to explain this chart in just simplified form if someone doesn't understand. So it is for that type of audience, that type of medical audience. So be cooperative and just support me. I am trying to help those guys, and also help me for active learning so I don't get lazy. Okay, it's clear, right? So we will go with aerobic. So we will give some examples of this aerobic and anaerobic. Okay, so branching filaments aerobic. The fine example will be, I will write in green color, no cardia, no cardia. And in anaerobic, I will write in black color. Anaerobic, we will give actinomyces. Actinomyces. Okay. So what is the important thing here is that nocardia, which is aerobic bacteria, comes under to the branching filaments This is gram positive bacteria, but it stains. It is also oxygen dependent, but it stains weakly acid fast. So acid fast is a taste, Ziel-Nielsen taste. Okay. What are the examples of strongly acid fast bacteria? We will give one example, that is tuberculosis, which is more prevalent in India, right? Which was more prevalent in India. Still, there are more cases of TB, right? The bacteria responsible for TB is Mycobacterium tuberculosis, which is strongly acid fast. That is Ziel-Nielsen test we will do for that. Here, nocardia is weakly acid fast. So it's acid fast, but it is weakly acid fast. So here we will write weakly acid fast. Okay, so here it is actinomyces. It is anaerobic bacteria, comes under to the branching filaments. Okay, it's neither cocci, neither bacilli. It is a branching filament bacteria, anaerobic, not aerobic. It's anaerobic, and it is not acid fast. It is not acid fast. It doesn't stain Ziel-Nielsen. So it's not acid fast. As simple as that. So we will write here not acid fast. Okay. So we will further divide. We will give some examples of aerobic and anaerobic of bacilli shape morphology of gram positive bacteria. So it's till now it's clear, I think so, guys, right? So we will go with anaerobic bacilli. So what are the examples of anaerobic bacilli gram positive bacterium? The first example comes to my brain. It's Clostridium. It's very famous. If you have read in your college years of UG years of MBBS, it's Clostridium and Cutibacterium. Cutibacterium. Cutibacterium has some ancient name or some previous name which we call Proponiobacterium. My pronunciation is not good. Please bear with me, but I am giving the exact fact name. Proponiobacterium. I will write for you in red so it's better. So Cutibacterium also you can tell it, or Proponiobacterium. Proponiobacterium. Yeah, it's Proponiobacterium. Okay, so it's Clostridium Cutibacterium. Now we will give example of aerobic bacilli gram positive bacterium. Okay, we will write in black only. So the examples are Listeria, Bacillus, not bacilli, it's Bacillus, and other great disease, diphtheria. The causing factor for that disease, the causing bacterium for that disease is Corynebacterium diphtheria. Okay, we will write the example. It comes under to aerobic section, so it is an oxygen dependent bacteria. So here we will write Corynebacterium diphtheria. Corynebacterium. Okay, as simple as that. Okay, so it's the basic algorithm we have. This we will now do complex. We will take a dive into this. Now cocci, we will differentiate cocci. We have differentiate this thing, branching filaments and bacilli, into aerobic and anaerobic. Okay, here it comes nocardia, it comes actinomyces in anaerobic side, while in aerobic listeria, bacillus, corynebacterium. Anaerobic bacilli it is clostridium and cutibacterium. Okay, as simple as that. Aerobic means oxygen dependent bacteria, anaerobic means non oxygen dependent bacteria. Now we will differentiate cocci into further based on a famous test. We know that catalyst test. You have heard it many times in your medical studies of second year, maybe, if you have been a very good listener in classes. Okay, or you have prepared exam, university exam. You have learned this topic, catalyst test. Okay, so we will divide it based on catalyst taste, whether it is positive or negative. If it is positive, okay, if it is positive, we will differentiate we will differentiate into staphylococcus Staphylococcus bacterium. Now, whether it is negative, if it's negative, I will better write in red so you understand it's negative. So here positive means staphylococcus, negative means streptococcus. It is very simple. Now we will further divide this staphylococcus based on coagulase taste positive, coagulase taste. If it is positive, it is coagulase taste. Coagulase taste. If it's positive, it is S O S. I have to buy a big board, a very small board. Okay, S aureus. This bacteria gives a golden yellow pigment. Yeah, S aureus, Staphylococcus aureus. This is a golden yellow pigment bacteria. It is a most common form and most widely considered as the Staphylococcus causative agent, most of it. While other are also common in, but it is common more in immunocompromised patients, while this can be also present in immunocompetent. But majority chances are that you will find this bacteria more, and the most important bacteria is this for the university exams, and also for PG entrance exam also they ask the more question about S aureus, the characteristics and also the treatment and that all stuff, diagnosis and that also. Uh, Now Google is negative. We will mention in it, right? Okay, so negative. So in this negative, we will do a novobiosine test. Novobiosine sensitivity. Novobiosine sensitivity test. So in this, further noticed, we will write positive. We will mention, sorry for this, we will mention positive by green sign, green color. Okay, so here also positive we will mention with green color, for negative for red color. So for positive, the taste will come, the bacteria which will included will be S epidermidis. S epidermidis. Staphylococcus epidermidis. Okay. While for the negative one, no biosyn sensitivity taste negative bacteria S saprophyticus. Saprophyticus and S epidermidis. Okay. So here it is S saprophyticus and here it is S epidermidis. Okay, so for example, so simplified form of this side of cocci, the cocci we will differentiate by catalase test. If it is positive, it is staphylococcus. If it is negative, it is streptococcus. If it is positive staphylococcus, we got to know. Further we will do a test of coagulase test. Coagulase test. If it is positive, it is differentiated into S aureus, which is most common bacteria of this subgroup. And after coagulase test, if it is negative, we will further do novobiosine sensitivity. And further, if it is positive, it is either S epidermidis, and if it's novobiosine sensitivity negative, then it is S saprophyticus. Now we will understand this bacteria in detail in further videos. It is the basically the some basic algorithm of gram positive we must to know, so the shape morphology and also which stays positive and negative it holds. Okay, now we will move to streptococcus. As we know that there are hemolysis, you have heard the word hemolysis. Okay, so basically, okay, before that we will understand that what is the staphylococcus characteristics, morphology. Okay, staphylococcus morphology is that it remains in clusters. It remains in clusters. While the shape of the clusters, you can see this cluster, they are bind to clusters, they remain united like hell. While in streptococcus the scene is different, it are in pairs or chains. So the shape will be like this, the chain form. Okay, you are getting it, it is a chain form, while it is a cluster form. So here I will write clusters. These are clusters, while this is chain form. Understand? Or pair forms, you can also see in pair forms like this, pair forms, diplococci. Okay, like that it is pair forms, chain form, most often seen in streptococcus. And also is a very basic, I know that everybody which are seeing this video, who are seeing this video, has got to know that gram positive are always purple in color. They are not red, they are not pink or any other color, they are purple in color. We will talk about gram negative color in further video, but here please understand that gram positive bacteria are purple in color. Okay, all these bacteria are purple in color by on the agar. Okay, now we will divide streptococcus, which are basically in pairs or chains based on hemolysis. Okay, so based on hemolysis, what is hemolysis? It is a defragmentation of hemoglobin or breakdown of hemoglobin. Okay, in simple words. Okay, the denature of hemoglobin, that is HB, we in short form HB, hemoglobin. You do a CBC and got to know that you get this much hemoglobin and that much, yeah, that hemoglobin, I'm talking about that hemoglobin. It's all the medical students has to be familiar with hemoglobin. So if the someone is non-medical also watching this, so I'm just telling them it's that hemoglobin which you do a CBC and got to know about that. Okay, here with hemolysis test, there are three types of hemolysis in our world: alpha hemolysis, beta hemolysis, and gamma hemolysis. All these hemolysis have different characteristics. We will understand this. This is alpha hemolysis, beta hemolysis, gamma hemolysis. What is alpha, beta, and gamma? Please understand this. Alpha hemolysis means it is partially denaturing hemoglobin. Partial hemolysis, I can write partial hemolysis, of course I can. Okay, beta hemolysis means complete hemolysis. Complete hemolysis, it will, so bacteria will denature or break the hemoglobin around their colonies completely. So you will see the clear halo of it. Understanding? The bacteria where the agar, where the agar is growing the bacteria, you will see the complete hemolysis around its colony. So see, you will see a clear halo. Like this, it is a agar. Okay. And for example, I am not giving a specific color to the colonies, but I am showing with green color. So it is a colony here. Okay. So the area next to it here. See, with the red color I am showing with, it will completely hemolyzed. Okay. While in a partial hemolysis, you will see brown color or any other or other color, but there will not be a complete hemolysis. You will not see a clear halo ring around the colonies which are grown in agar. Okay, so this green are shown by colonies of bacteria, while red is showing the clear halo. Okay, clear halo of breakdown of hemolysis. And in further, we will differentiate gamma hemolysis. What is gamma hemolysis? Gamma hemolysis means no hemolysis. It's it's no hemolysis. Okay, it's no hemolysis. Gamma hemolysis means no hemolysis. There is no hemolysis. There is no denaturation or broken down of hemoglobin occurs by the bacteria. Please understand this. It's very important concept. Now, based on this characteristic of hemolysis, we will differentiate streptococci, and for that we will do some test for further subtyping the bacteria. Okay. For example, gamma hemolysis, we will do we will grow this bacteria in growth in 6.5% NaCl. NaCl. Okay, NaCl. Okay, it's compound NaCl and PVR PYR status. Okay, growth in 6.5% NaCl and PYR status. I will write the full form at the end. It is basically pyronidal. So I will write it further. First of all, I will differentiate the bacteria for you. So if the bacteria growth in 6.5% NaCl and PYR status and it is gamma hemolysis, and if it is positive, then I will mention it. The examples are Enterococcus, the famous bacteria name Enterococcus. Enterococcus. The example of Enterococcus are E. fecum, E. fecalis, E. fecalis, E. fecum and E. fecalis. And if it is negative, then the examples are non-Enterococcus, coccus. An example is S. galactolyticus. S. galloticus. 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 Pronunciation is bad. Uh, so it's been clear, right? Now we will further go to the beta hemolysis. So which bacteria supports beta hemolysis concept? For that we will differentiate beta hemolysis by some test known as PVY status will be common here, but here we will do further test. While for alpha hemolysis the test will be optochin sensitivity and bile solubility. For beta hemolysis PYR status and status, while for here optochin sensitivity and bile solubility. Optochin sensitivity and bile solubility. Here PYR status, and the examples of the bacteria will be, if it's positive, group A streptococci. Group A streptococci. This is S. pyogenes. S pyogenes, group A pyogenes or group A streptococci. Here it will be negative, then it's group B S galacti, S A galactia, or here it will be group A streptococci, that will be S pyogenes. Okay. Okay. And for alpha hemolysis, we'll differentiate by the test, that is optogen sensitivity and bile solubility, and it will be, here it will be negative, here it will be positive, here green color. Okay, okay, so here it will be positive. So for positive alpha hemolysis will be, the example will be as pneumonia, pneumonia maybe, the as pneumonia causes pneumonia, while as in adults, while the group B as E. galacti also causes pneumonia, but it is most commonly in childs or children, not adult or not adolescents. So as pneumonia is considered to cause pneumonia, and also group B as A. galacti is also responsible for pneumonia and meningitis. Sorry, Group B as A. galacti is responsible for meningitis in children, while Group S pneumonia is also responsible for meningitis in adults. But there are difference. See, S pneumonia is for adults. Meningitis, it's not about pneumonia it causes, but meningitis. If we talk about meningitis, that S pneumonia causes meningitis in adults, while S group B S A. galacti, that is S A. galacti, Streptococcus A. galactis, causes meningitis in children. Okay, it's the most common. While Streptococcus pyogenes, you know, it's very famous. And also remember one thing, that Streptococci and Staphylococci has also some toxins, while Streptococci has endotoxins, while Staphylococcus are responsible for exotoxins. Okay, endotoxin are responsible for septic shock also, while exotoxins are very lethal sometimes and causes death in some further notice of some days. Okay, so the lethalness is are more in staphylococcus, while the lethalness is also present in streptococci, but they are responsible via endotoxins, so it will do in a progressive way, while the staphylococcal thing is wild, quick, quite quick. Okay, now negative negative will be alpha hemolysis, optogen sensitive, biosolubility positive S pneumonia, and S negative will be streptococca viridians. Cocci viridians. The examples of streptococcus viridians will be S mutans, S mitis. See, S mutans, there is streptococci mutans and S mitis. There are types, there are examples of streptococci viridians. These are basically very notorious for, I say, it's responsible for heart. Okay, they very causes bacterial endocarditis. You have heard the causative agent called streptococci. You have done some MCQ or you have read somewhere. It will be okay. The answer will be the S mutans and S mitis. Also, one another bacteria is also present under streptococci viridians, that is S sanguinis, also responsible for bacterial endocarditis. Okay, they causes this bacterial endocarditis via dextrans. Okay, causes bacterial endocarditis via dextrans. Okay, that's okay. It is the most important MCQ I have talked earlier. That is Group B S A galacti causes meningitis in children, while S pneumonia causes meningitis in adults. Okay, so it's simplified for you. Negative Streptococcus viridans, and your S pneumonia is for positive partial hemolysis. It is alpha hemolysis. So yeah, this is the whole algorithm of gram positive bacteria, which are purple in color. Okay, very bad in arts. I should have not took. Okay, very bad in arts. Yeah, sometimes feeling that. Okay, so it's subdivided into gram positives are subdivided into bacilli, cocci, branching filaments. Branching filaments are subdivided into aerobic and anaerobic. Aerobic is nocardia, which is weakly acid fast. Anaerobic is actinomyces, not acid fast. That is Zell-Nielsen test. Okay. So further we'll divide bacilli into aerobic, that is Listeria, Bacillus, Corynebacteria, anaerobic, Clostridium, Cutibacteria, which was earlier called as Propionibacterium. For cocci, that is this shape morphology, we will divide it by catalase stage, that is positive staphylococcus, which are found in cluster forms. Further, we will divide staphylococcus into coagulase stage, that is it will be positive. Then S aureus, which is golden yellow, which will show golden yellow pigment in agar and in culture. And if it's negative, then it's no biosyn sensitivity test. If it's no biosyn sensitivity test positive, as epidermidis, and on S saprophyticus negative, then okay. See, S epidermidis also can be found in some catheters and that also. So the infection can be transmitted by if the unhygienic practice of catheter installation in females or in males. Okay, then can also cause S epidermidis infections. Now we will move to streptococcus, which are found in pairs or chains. Streptococcus is divided by hemolysis, alpha, beta, and gamma. Alpha means partial hemolysis, beta means complete hemolysis. I have given a proper explanation how the hemolysis occurs around the colonies of the bacteria. That is, will be a clear halo, while it is gamma hemolysis in which no hemolysis occurs. So further we will do a test called growth in 6.5% NaCl and POIR status. So if it positive, then it is enterococcus, E fecum or E fecalis. If it's negative, then non-enterococcus S galotyticus. And in beta complete hemolysis, there also will be a POIR status. And if it is positive, then group A streptococcus, and that is also called as pyogenes, and group B as A galacti. And alpha hemolysis, we will do a test of protein sensitivity and biosolubility. If it is positive, then as pneumonia, and if it is negative, then streptococcus viridans, S mutans, and S mutis. These streptococcus viridans are responsible for bacterial endocarditis by dextrans. So this is the complete chart of simplified chart, and somewhere it is complex. So you have to mug up, or you have to understand this whole gram positive algorithm. So in further videos you can easily understand which bacteria have these characters and why it causes this infection, because of what. So it's very important. Based on shape morphology we have divided, and based on taste we have divided. Okay, yeah, it is gram positive algorithm. So like this I will make some few videos, and I will improve, and I will polish all the further videos which I make. Please support this, please subscribe and like the video, and also share to your colleagues for the better simplified form. And I'll also try to make some informative and more good videos in further notice, in further time. Yeah, it is my first first YouTube video based on medical. This is clinical bacteriology, and I will do this video explanation from first aid, most probably, because it's very simplified to understand and give explanation. Okay, I will not go to the textbook thing. I will try if I get to have time. I do in this my free time for the active learning. Please support me, guys. I will provide the best videos I can. Okay, hit the subscribe button and also like, share, and enjoy. Namaste.